So what can you expect from a conscious connected breath session? Well, it's suitable for almost anyone. So whether you're a child or someone in your 90s, it's all okay. In one-to-one sessions, whether virtual or in person, we'll start by having an initial check-in, and then the breathing part of the session will last about 30 to 40 minutes. And what we'll be doing together in the first session is bringing some awareness into you about how you breathe, using the correct pattern, the correct muscles, the correct position that supports you and gets you to get the most out of your breathing. In terms of what you can expect, well, everyone is different. Some people's experiences are great, some are good, and some are just off the chart incredible. When I first began to explore my breath work, I had no idea how I breathed, and I'd never really thought about it. So it may be the same for you in the session, but we'll find out. Now, there are 5 components to the session. The first is you'll be breathing through the mouth, and the reason for that is volume, so you can take in much more oxygen through your mouth than through your nostrils. The second is that I'll ask you to focus and put your hands on your lower abdomen, as with each inhale, you'll be inhaling into that area throughout the session. Now that's because most of us breathe, about 80% of us actually breathe from our chest. And the objective here is to get you taking the breath where it isn't. And in most cases, that's the abdomen. So whilst it may feel a little bit strange when you begin, that's okay and perfectly normal. I'll be getting you to use the correct muscles to breathe and by getting you to focus deep into your belly. And this is so you can start using your diaphragm, which is the muscle that lines and attaches to the 11th and 12th ribs in the lower rib cage. This expands the lungs and allows you to access more of your lung capacity. The third component of the session is to allow for a continuous flow of the breath. And this is the connected part of the breath session. And it's where most of the magic happens. It turns on the autopilot self-correction system. The fourth element is the exhale, which is short and soft, so it's quite different to regular breathing. And the final component of a conscious connected breath session is the inhale. Now this is where the majority of your focus is throughout the session. And that's because we're bringing in more oxygen and the energy on the inhale. And it's about 4 counts inhale to 1 count exhale. Now we'll also be bringing in a couple of other elements to the session, and one is sound. Now this is used primarily to open up the respiratory system and also helps to clear any emotion that's coming up if there is any. And the other is a little bit of movement. So that brings more power and energy into the body and almost supercharges it. And in terms of what you can expect on a physical level, you'll certainly feel more supercharged and energized. And this is due to bringing in about double the amount of oxygen that you're used to, which is a really lovely feeling. Emotionally, generally you'll feel a reduction in your stress levels and you'll feel lighter. And if you start practicing breath work regularly, it'll start to translate into more joy and happiness in your life, I'm sure of it. And on a tangible level, it's one of the best ways I've found to explore more of yourself and getting to understand who you really are and what you're about. Now I also find that I sleep better after a breath session. And it's useful for pretty much everything. So depression, PTSD, anxiety, physical ailments. Now, as I've spoken about, each person is different, but one session is enough to make a difference. And if you go on to do breath work regularly, I believe it will totally transform your life and your relationships. I've spent 20 years trying out different modalities myself. And the reason that I'm teaching conscious connected breath work is, for me, it's the most effective tool I've found towards optimum physical and emotional health.